Amendment to the SPC regulation introducing a manufacturing waiver was a fundamentally important legislative amendment for our industry. We were very active mobilizing the whole manufacturing sector in support of this measure. It was indeed very challenging. We had a lot of opposition from the originator industry, and as a result, the initial proposal was watered down to a certain extent, making it difficult in reality to use that version for job creation. We were very happy throughout the process, however, to engage with the European Commission, the European Parliament, the European Council, the Member States, around explaining why our industry needs to invest and have a good framework for manufacturing, and why the SPC waiver was an important component in that. And we were able, through a 9-month process of intense dialogue with the key institutions, to deliver on that promise, to enable our industry to manufacture for export, to manufacture for day one launch 6 months ahead of the launch period, and to have more limited notification measures. And I thank here all of the associations who supported us in this work, the European institutions who were so heavily engaged in this important discussion, and now I think our industry can move forward towards investment.
Yes, right, Adrian. This is now truly the first time that we have a leveled playing field with our non-EU based competitors. It means that we can now utilize all the investments in manufacturing for biosimilars, complex generics, to supply and support markets outside of the EU when there's still a valid SPC in Europe. And that we can launch our products from European manufacturing here in Europe, let's say, when the SPC expired. So the implementation of the SPC manufacturing waiver, there are two aspects I would like to talk about. The first one is the implementation in the countries, and here we call on the authorities to have an eye to prevent frivolous litigation which would delay patient access and the implementation. The second one is the link to our campaign we had 2 years ago with the start of my presidency, Access to Medicines, but also one of the main messages from our recent manifesto, the improvement of the equity of access to medicines. The SPC manufacturing waiver will improve the access to medicines for patients both in Europe and abroad through earlier market formation with more competition, faster access to medicines. And so therefore it fully fits to the vision and mission and our values we have at Medicines for Europe as a generics industry in Europe.
Absolutely, Mark. I couldn't agree more. The SPC waiver has to be implemented in the way it was intended by the European legislator. It's really, really important. Not only are we going to be able to use this to improve access to emerging markets who are requesting high-quality generic and biosimilar medicines be exported to their markets so they can benefit from greater access to these therapies. But we also know that it's important that our industry can use the 6 months period to prepare for day one launch in Europe at SPC expiry. We've seen the numbers, how important this is to reduce the development costs and the tech transfer costs for our industry, and this will be a very compelling case for increasing access. And I also agree with you that the legislation is very clear that any attempt to use frivolous litigation to block our industry in this regard should be carefully monitored by authorities, including the European Commission and national governments.